Mike Knight is the Medicare Savings Program and Medicare Advantage Specialist. Mike, welcome to the show.
Thanks for having me.
All right, so what do people need to know? There are people with special needs. Everybody needs health care coverage, but there are people with special needs, and you can help them.
Absolutely, we can. Yeah, if they have Medicare, we can definitely help them. If they have Medicare, Medicaid, we have special plans designed to meet needs that possibly they can't have met with just Medicare and Medicaid.
What's the most misunderstood thing about this whole process?
Confusion, as you were mentioning earlier. They think that it's overwhelming, and if they come in here, we can definitely sit down with them and just lay it out where they can understand it and make it much easier for them to see if this is going to be a plan that would work for them.
And this is a unique situation because there are people here to talk to. I mean, that's just such a great advantage. And, you know, boomers grow up at a time when, we went face-to-face and talked to people, and now you can do that at People's Health.
Yeah, that's a great benefit that we have. We have a bunch of agents here today. We have agents that are available Monday through Friday, 8 to 5. So if anybody wants to come in, if they can't make it today, definitely come tomorrow, come next week, come during annual enrollment. We'll be happy to help them.
Mike, are there people spending too much on their health coverage and that they would save money coming here?
Absolutely. Yeah, there was some people, I did a presentation earlier today, that are spending some money that they don't have to. That's one of our plans is really going to benefit them. So it's one of those things about getting the information and finding out if it's right for them.
Right. What are mistakes that people make when they come to get coverage, or when they're looking for coverage, not necessarily here, but just in general?
Probably the biggest mistake is inaction, not doing anything, and then finding out a couple of years later that, I should have signed up for something, and now Medicare is going to penalize me for not taking action when they should have. And that's one that they can avoid if they're coming on Medicare. During annual enrollment, it's a good time to take a look at all of that.
And this is Medicare Enrollment Day.
It begins on the 15th and runs through December 7th.
Yeah. So this is the time to do it. You've got time to do it. And if you can come by today, great. If you can't come by today, just come by and get this taken care of. Is there a number that is an average number of savings that people get?
As far as it's really going to depend on the individual, on their health conditions, on what they have going on. But as far as an average number, I don't know anything.
But it's significant enough to do it.
Oh,
I mean, to make the change, and you know you see the savings, and then if you think about how if you didn't do this and you went on and you continued to pay that extra money at the end of the year, it's going to be a significant amount of money that you're going to have spent that you didn't have to spend.
Right. That's the key point. Is that it's things that they didn't have to spend. If they would have taken a little bit of time, invested a little bit of effort in looking into plans, look what we have to offer, and see if it can meet their needs. And if so, it's a zero premium plan. So they can come in here. It's not like we're asking for them to bring their checkbook. We're paid by Medicare. And they can get a lot better coverage than just being on Medicare alone.
See, I think that's the amazing thing about this, is it doesn't cost anything. Mm-hmm. I mean, you direct them. And first of all, forget about the supplements. Just getting on Medicare is a challenge for some people. And you help usher them through that, and then also help them with the supplement plan that they need to really be fully covered or to have pretty close to the coverage that they had before.
Yeah, we can definitely help them navigate getting on Medicare, which it's pretty straightforward if you're already drawing Social Security. If you're not, then you do need to make a visit over to Social Security and ask them for paperwork to fill out or go online and do it. Once we get to that point, then we can show them the products that we have that will help them save their money with Medicare.
And there are enough different plans to satisfy people who need different things.
Yeah, we have a bunch of different plans that we can offer them based on if they have just Medicare, they have Medicare, Medicaid. We even have one for retirees that are military, if they're a veteran. We have a Patriot plan, so if they have drug coverage somewhere else, we can offer them even benefits that won't interfere with that drug coverage.
So if somebody's already on Social Security, it would be very easy to come in here and get on Medicare. Well, if you're on Social Security, you have access to Medicare.
Usually you do.
Yeah.
Not always, but generally you do.
And then you help them select the supplement plan that goes with that.
Yeah, we'll look up their doctors. We'll make sure we cover their medicines. That's the two biggest things that we need to get past, is just making sure that we can fit their needs. And if we can do that, we got some great products here.
Yeah. When you talk about products, give me an example of what a product is.
So specifically, I mean, we have Detroit Choices 65, which is probably our premier plan, I guess you would say. And that one offers coverage for vision, for dental, on top of offering for medical care, going to doctors, going to hospitals. It offers an over-the-counter benefit, health club memberships, which all of our plans do offer also.
Yeah. You know, it's there's a time in your life when you can take advantage of government opportunities, and this is a great opportunity to get your coverage. You know, we need it. I know there's always a lot of criticism of our healthcare system and what we all have to pay, but I think it's just so phenomenal that people's health can just help usher people through this process.
Yeah, turning 65 is a big milestone because it opens up a lot of doors that even people my age don't have access to right now. But it's a great plan.
Yeah, and take care of yourself, and you'll feel great, and you just take advantage of this, and hopefully you don't need to use your health coverage very often.
Right. Yeah, we'll keep you healthy. We got gym memberships if you want to go there and help you exercise. A lot of preventative care on these plans.
See, that's a key. That's a key too. That the insurance companies and Medicare, I mean, they want you to be healthy, because if you're healthy, then you don't cost them as much.
True, and it's more so the long-term look at it. We want to, if you have something going on, we want to help you manage it. If you don't have anything going on, we want to help you prevent it. So just from point A to the end, we want to just make sure that we're a partner in your health care and helping you out along the way.
Okay. Has reaction been good today? It seems like you had a lot of people in here earlier.
We had a lot of people in here. Yeah, we had almost 30 people in there for that seminar. In and out all day, people have been coming in.
That's great. Mike Knight is a Medicare Savings Program and Medicare Advantage Special Needs Person. Thank you very much for your time and the information.
Absolutely. Thanks for having me.
Cool. And remember, we're at People's Health Medicare Center until 4 o'clock, but they're open for you all the time. Veterans and Causeway. What are the hours?
8 to 5, Monday through Friday.
Okay, 8 to 5, Monday through Friday. You take the weekend off. They take the weekend off, too. That's cool.
We work, we just don't staff the center.
Okay. Do you ever go over to Party City and think about maybe throwing a little bash over here?
We do have some balloons around, so
okay, cool.
It might have come from Party City.
Mike Knight, thanks for being with us.